Hello, my name is Rafael. I'm from Portugal. I'm a nurse. I have a clinical specialization in rehabilitation nursing. I'm currently doing my PhD in the Catholic University from Portugal, and I'm also working in the Health Sciences Research Unit in Coimbra, from the Nursing School of Coimbra, where I'm developing my research. My research focuses on foot and ankle disorders in nursing students, although I'm also looking at nursing professionals. We know that musculoskeletal disorders are an important issue in many healthcare professionals, and nurses are spending many time walking many kilometers and also standing in the same position. And we know that in general more than 20% of nurses and nursing students want to leave their professional or the nursing degree because of the uncomfortable disorders they get from the musculoskeletal system. Also, we know that more specifically 24% of nurses are absent from their work due to foot and ankle disorders specifically. So we want to prevent a long-term shortage of nursing professionals, which is an issue in Portugal at the moment, but we also want to solve the issue remotely in the nursing degree. So why is this important? Because musculoskeletal disorders, and specifically foot and ankle disorders, they have a great impact in quality of life, and some important factors which we are also looking at are footwear, global health, physical activity, habits, and other factors. So my PhD project is divided more or less in four main activities. In the first one, we have developed a literature review to map the most important and the most common foot and ankle disorders in nurses, in the nursing professionals, and we found that pain was the most often reported disorder. Sometimes pain is reported as a symptom, but pain itself can become a disorder. Then the other part of my PhD study, we are translating and validating two instruments developed in Finland by Professor Minna Stoltz. One of those instruments, it measures knowledge regarding general foot and ankle issues like anatomy, like structure, like footwear, like self-care. And then the other instruments, also developed by Professor Minna Stoltz in Finland, it's a self-reported foot health instrument regarding nail health, regarding foot structure, regarding pain. And then we have a cross-sectional study where we are evaluating, using these instruments, we are evaluating foot health, self-reported foot health, and also the podiatric profile of nursing students. Then nursing students go for a 5-month clinical learning in the hospital, and then they return to the lab where they also evaluate again the self-reported foot health and the podiatric profile. How do we evaluate the podiatric profile? We use a force platform which is on the ground, so they need to take 3 photos of each foot on that platform while walking. So it is a dynamic evaluation of pressure and force that the foot exerts on the floor. That picture, it gives us the mean pressure and the mean force that the foot is exerting on the floor. So we are comparing that podiatric profile, so pressure and force exerted on the floor, before and after they go for a 5-month clinical setting in the hospital. And we are also asking how many hours they are spending walking or standing, and then we correlate all this data with the self-reported questionnaire, and we want to understand the influence of standing environments, so walking and standing in the same position, on these factors. And the last study that we are performing, and the most important outcome of our PhD study, is developing some recommendations and guidelines specifically for nursing schools and institutions regarding foot health, and also for nursing professionals and nursing students, so we can empower them to take a better self-care for the foot and ankle disorders, thus reducing stress, musculoskeletal stress, and increasing quality of life and happiness at work also.